Hello everyone, I am Hasnan Patel, final year Mbbs from Vadodara, Gujarat. Today in this video lecture, we are going to continue with the toxicology, lecture number 3, and today we are going to learn agriculture poisoning. Before I start, I want you all to keep your pen and paper aside because notes of this video lecture are mentioned down in the comment section. As you all know, India is an agriculture based country. Most of our population relying on agriculture as a main source of income. There are many chemicals used in this field. For example, herbicides and pesticides. These chemicals are toxic to human being. So when it get ingested in the human body, it can lead to the poisoning. So we're going to learn each and every poisoning occur in this field in a detail. Most important in this chapter is the organophosphorus compound and organophosphorus poisoning. So organophosphorus are actually the ester of phosphoric acid. They are classified into two groups. First is the alkyl phosphate, another one is the aryl phosphate. This classification and example no one going to ask, this is for your knowledge. So alkyl phosphate example are HETP, TEPP and malathion. Aryl phosphates are diazinon and chlorothianone and parathinon. So the main thing which examiner going to ask about the organophosphate poisoning, it's its absorption, metabolism, action and its treatment, and lastly its post-mortem changes. So let's start. Organophosphorus compound can absorb through any route, even it can cross placenta. So when you are treating organophosphorus compound, first we do is to remove and change clothes because we don't want the unabsorbed poison to get absorbed in the circulation. So it can absorb through all routes and even cross placenta. Secondly, once it get absorbed in our body will try to detoxify it. Our body will use our enzyme cytochrome P450 monooxygenase and it will detoxify it. Organophosphorus compound are mixed with a chemical called aromates. These give organophosphorus compound a typical kerosene like smell. Now we have understood it get absorbed through any route and how it get metabolized. Now once it enter our body, what organophosphorus compound going to do? What is the action of this compound? Action of this organophosphorus compound, it bind firmly with the esterase enzyme and it cause its inactivation at the myoneural junction and synapse of the ganglion. As a result, the acetylcholine get accumulated at the parasymptomatic and symptomatic sites, and this produces syndrome. Let me explain you this with a really easy diagram. You can see over here it's a myoneural junction. Over here, these our small are our acetylcholine particles, neurotransmitters. They are supposed to get destroyed through our enzyme acetylcholine esterase. After its function is completed of acetylcholine, it gets destroyed by acetylcholine esterase. But organophosphorus compound bind with acetylcholine esterase and causes inactivation. As a result, at the myoneural junction, there is the accumulation of acetylcholine and it gives a syndrome. So it can have two manifestations. It can have a muscarinic effect and nicotinic effect. We're going to learn each of them really nicely. So we will start with the muscarinic effect. So signs and symptoms of OP poisoning is similar to the physostigmine and pilocarpine or acetylcholine overdose. So let me explain you this really well. As you all know, OP poisoning treatment is atropine and atropine overdose treatment is physostigmine. So by this we also got to know that physostigmine and atropine are antagonists. They have exactly opposite action. So atropine is a drug of choice in case of the OP poisoning and physostigmine is a drug of choice in the atropine poisoning. So by this we can also relate that the action of the physostigmine and OP poisoning are similar. That's why the signs and symptoms are similar to those of physostigmine and pilocarpine. I hope you understand this really well. Now we're going to learn about the syndrome which occur in this poisoning. It is sludge. Sludge, S is for salivation, L is for lacrimation, U is for urination, D is for defecation, G is for gastrointestinal distress and E for emesis. Emesis is nothing but the sensation of vomiting. So I hope you understand sludge. Very important. Repeat after me. S for salivation, L for lacrimation, U for urination, D for defecation, G for gastrointestinal distress, and E for emesis. We understand the muscarinic effect. Let me illustrate with the very funny drawing. So by this we can understand each and every symptoms. So S for salivation, L for lacrimation, U for urination, D for sludge, SLUDGE, gastrointestinal distress and defecation, and it will cause meiosis. So sludge, salivation, lacrimation, urination, defecation, gastrointestinal distress, and emesis. In this photo we have seen salivation, lacrimation, urination, defecation, gastrointestinal distress, and emesis. Hope you understand this one. Now we are going to learn about nicotinic symptoms. So nicotinic symptoms occurs first it will cause the contraction of the striated muscle, and it will have a persistent depolarization. As a result, it will paralyze the muscle, and symptoms will be muscle cramp initially. So we learn about muscarinic effect, nicotinic effect. Now what are you going to do with the sympathetic ganglion? It will cause hypertension, tachycardia, pallor, mydriasis. And mydriasis is actually the dilation of pupil, but it affects our muscarinic receptor, and it will cause more meiosis. As a result, we get the pinpoint pupil, a typical sign in case of the OP poisoning, pinpoint pupil. So you understand the signs and symptoms. We understand the muscarinic symptoms, sludge, nicotinic receptor. What occurs? There will be paralysis of the muscle, striated muscle, sympathetic ganglion, there will be tachycardia, hypertension, pallor, mydriasis, but overall it causes a meiosis. Now we have classified the poisoning on the basis of its severity. Poisoning could be mild, it could be moderate or severe. So how we have classified the poisoning, OP poisoning, into severity? It is classified on the activity of the acetylcholine esterase enzyme. How much enzyme are left or spared from getting combined with the organophosphorus. Organophosphorus inhibit this acetylcholine esterase enzyme. So how much enzyme is left? On that basis we have classified it. If 20 to 25% of the acetylcholine esterase enzyme are spared, it is called mild. If only 10 to 20 is left, that is called moderate, and if less than 10 are available, that is called as severe. So signs and symptoms in mild, moderate and severe poisoning are: first, in mild there will be nausea, minimal muscle weakening and cramp. In a moderate there will be the sludge and tremors, and in severe case it will be the have sludge as well as the respiratory insufficiency. On a clinical base we can't classify them, but for our understanding this is how we have classified. There is one rare finding in case of the OP poisoning called chromodacryuria. Chromo means color, dacryuria means tears. In a rare case there will be red tear shedding from the eye. This occurs because of the accumulation of the porphyrins in the lacrimal glands. There is one more thing called delayed sequelae. It is delayed peripheral neuropathy that occur after 1 to 5 weeks after the exposure, and the signs and symptoms is similar as the Guillain-Barré syndrome, acute flaccid paralysis. So by this we have done the signs and symptoms. Now we are going to learn the treatment. So you hope you understand. Organophosphorus we have classified into alkyl and aryl. No need to remember the examples because no one is going to ask you in your exam. Then we have understood the absorption. It get absorbed from all routes. It can even cross placenta. Then we have learned about its metabolism from cytochrome P450 and monoxime. Then we have understood how it get, what are the signs and symptoms, what it does to our body. We understand about muscarinic, we have understand about nicotinic, sympathetic ganglion. Now we will learn about the treatment. So firstly, when a patient comes to us, as we all know, it get absorbed through all routes. It can cross even placenta and it get absorbed through skin. So firstly we want to prevent the unabsorbed poison to go into the circulation. So what we do first, we do remove the exposure. We remove the exposure by removing the clothes which might be having the organophosphorus on it. So we remove the clothes, we decontaminate it, then we do stomach wash. We do stomach wash with the help of potassium permanganate and activated charcoal. And for muscarinic effect, we give atropine. Question is still, when we give atropine, many students do mistake in the viva. They say we give atropine till pupillary status are fixed, that pinpoint pupil is now resolved, but this is not the right answer. In atropine are given till the tracheobronchial tree is clear. Please mark this thing as a star and remember this point. Atropine is given till the tracheobronchial tree is cleared. And there are some specific choline esterase enzyme reactivator. Organophosphorus bind with the esterase enzyme and inactivate it. There are some reactivator which reactivate its function. So example are DAM, PAM. So diacetyl monoxime oximes. These are oxime groups. They reactivate the esterase enzyme. Another one is the pyridine aldoxime. They compete for the phosphate group of the organophosphorus compound and it releases from the choline esterase enzyme. Let me explain. Let me show you these are our PAM. Let me explain you this with a really nice drawing. So we can see over here is acetylcholine esterase which is bind with the our organophosphorus compound and it inactivates the esterase enzyme. It has a phosphate group. These are our oxime. Our oxime compete for the phosphate group, and as a result, our oxime will release our acetylcholine, which it was inactivated. Now it start its function. So look, now it's our smiley acetylcholine esterase. Please don't draw this thing in your exam; you won't get marks. And at last, before we complete what this phosphorus compound, what's gonna happen post-mortem changes. We understood its metabolism, absorption, everything. Now comes the last, post-mortem appearances. Post-mortem appearances in case of the organophosphorus compound poisoning will be similar to asphyxia signs. There will be facial congestion, cyanosis at the lips and nose and fingers, and in stomach there will be the smell like kerosene. Why? We learn this because of a compound called aromax. And there will be congestion and the petechial hemorrhage in stomach mucosa. So we have completed the first group, very important one, organophosphorus compound. Now there are small group topics, very easy, you're going to remember it really well. We're going to learn carbamates. Carbamates are actually derivative of the carbonic acid. Example is Tamix and Bagon. What it do, it is also anticholinergic. With the help of carbamylation, it inactivates it. Signs and symptoms of carbamates appear in from 15 minutes to 2 hours, and it spontaneously resolve from like in 28 to 48 hours. And treatment of choice in this case is plalidoxime. This is enough for carbamates. Now we're going to learn about organochlorines. We learn with the organophosphorus, carbamates. Third is our organochlorines. Example of organochlorines are DDT, benzene hexachloride, cyclodidines. They absorb through all routes, including skin, and it interferes with the nerve transmission. First it stimulates it, then it depresses it. Now we will come to our fourth part, that will be our entrins. Entrins are also known as the plant penicillin because it has broad spectrum. It's a broad spectrum insecticide and pesticides, because it has activity against various insect and pests, similar to our penicillin, our antibiotic. So it is our plant penicillin. So just for our remembering this thing. And polycyclic polychlorinated hydrocarbons, cyclorine group insecticides. And signs and symptoms begins in 1 to 6 hours. Major signs are like salivation, nausea, vomiting, and most important, there will be mydriasis, dilated pupil. In case of enterine poisoning, there will be dilated pupil. Mark a star over here. This was asked in a previous year question. which of the following organophosphorus compound will cause the dilation of the pupil, or it was which of the following agriculture poisoning will cause the dilation of pupil or mydriasis. It can cause it can cause coma and death due to respiratory failure. And post-mortem appearances, there will be smell of kerosene and from mouth, and enderine resists putrefaction. I have already explained this in our first lecture of general toxicology, and poison which resists putrefaction. So enderine was the example over there. So if you forgot this thing, just go again in that notes and have a look. Now we'll come to the fourth part, important one. So important in this chapter was the organophosphorus poisoning, and another one is the aluminum phosphide poisoning. So aluminum phosphide uses is a fulminant, pesticide, herbicide, rodenticide, and grain preservatives. Action of aluminum phosphide, that when it come in contact with moisture, it releases a toxic gas called phosphine, which inhibit the respiratory chain enzyme and has the psychotoxic action. Phosphine is a systematic poison. It affects all the organs. Absorption, first it will from GI, it will have simple diffusion and damage all the internal organs. You don't need to go from one circulation to another, it will just with a simple diffusion. Signs and symptoms depending on the dose and severity. First, we will understand the mild inhalation. If aluminum phosphide is inhaled, mild, not in a severe large quantity, in a small quantity. So what will be the signs and symptoms? First, it will irritate the mucous membrane. Then it will have the respiratory distress. And other symptoms will be like dizziness, fatigue, and tightness in the chest. Now, if this poison is ingested, what will be signs and symptoms? If it is ingested not in a large quantity, it will have nausea and vomiting. And if it is ingested in a large quantity, it will cause a moderate or severe poisoning, and it will have the systematic manifestation. And main point over here, aluminum phosphide don't have any specific antidote. This question was asked to me in my viva. I remember it was my internal viva, and this question was asked, which is the specific antidote for the aluminum phosphide? So remember, there is no specific antidote in case of the aluminum phosphide. So how are we going to treat patient? We will do the similar like decontamination and all that part. So we will give activated charcoal, liquid paraffin. By this method, we will treat the aluminum phosphide poisoning. In the end, we will have to learn about the postmortem changes. So postmortem changes, when we open the body, we will have the garlic odor, and the congestion in the small intestine will be decreasing order. So by this we have completed our aluminum phosphide, and now only few small topic is left. Before I continue this, I want you all to explain one topic which was left in our previous lecture of antidotes, that was universal antidote. So universal antidote, it's made up of it's made from 4 parts. So it is 2 parts is activated charcoal, 1 part is magnesium oxide, and 1 part is tannic acid. Tannic acid also found in tea. So examiner might ask you in which substance tannic acid is found. So it is in tea. Now we'll go to the last portion of this chapter, that is paraquat. It is also known as gramoxone. It's an herbicide. So what it does, it increases the superoxide, which causes the cellular disruption, and as a result there will be multi-organ failure. By this, most of the topic of agriculture poisoning are covered. Last, there was one MCQ which was also asked, soman, sarin, and tabun. What are those? They are nerve gas and they are organophosphate. By this, we complete our agriculture poisoning. I hope you remember everything. We learn about organophosphorus compound, then we learn about carbamates, organochlorines, their derivatives, aluminum phosphide. We also learn about enderines, and this was about agriculture poisoning. And please go through the ready and read organophosphorus compound. I have explained this in my best capability. If there is any change if you want in this video lecture, because I'm making it for the first time only, so if there is any change you want, any change in my speech, please let me know in the comment section. I will try to improve it. And please do subscribe just to keep me motivated to make more videos. Thank you so much. Stay curious, keep learning, and have a nice day.